hospitalized across the province, and 23 of whom are in intensive care unit. We do not have any additional deaths to report, so we remain at 13 today, and I'll talk about that in a minute. But really, the good news is we now have 173 people who have fully recovered from COVID-19. So that's 28% of our total cases. And I think that's a really positive thing. It shows us that most people, particularly young, healthy people who have milder illness, are able to be managed at home and are recovering from this. And the other positive thing around that is that we're learning from around the world that once you've recovered from this, you have immunity for a period of time, at least for the next few weeks to months, which is really helpful, I think, in encouraging people and supporting people to be able to, if you're a healthcare worker, to safely work with cases of COVID-19. Here in BC, when we talk about the numbers of deaths we've had, I know there's been a lot of comments that have come into me that our death rate is very high, and that means that we're on a trajectory that's very similar to countries like, or areas of the world like Northern Italy and others. And I just want to put that in a little bit of context. Most of our deaths, tragically, have been related to the one long-term care home, the Lynn Valley Care Home, where the outbreak had been going on for some time before we were able to get a handle on it. So 10 people, 10 of the residents of that facility have died in this outbreak. And that really shows, when we look at the overall numbers and the people who have died from this, we consider that as one event rather than 10 individual events that reflect a number of other cases in the community. It also reinforces the importance of all the work that we need to do to protect our elders and those most vulnerable, particularly in our long-term care and assisted living facilities around the province. I have also heard some media reports, and I know there's been quite a lot about this recently, about a dentist who had attended the Pacific Dental Conference, who recently passed away. That person was known to public health and was associated with the Pacific Dental Conference. The public health investigation had been done, so the contacts of that person, any close contacts, were identified and were put into isolation, and anybody who was at risk from exposure to this individual was identified. It is tragic that he passed away, and I understand the coroner is investigating, and we do not have any more information at the moment about his death, but the circumstances, once the circumstances are confirmed, I'll be able to share that with you. I will share as well that this conference is a major source of some of the infections that we've been seeing in BC. There are now up to 32 people that we can link directly or indirectly to that conference. All of those people attending the conference were notified of a positive case who was there and asked to self-isolate. And then as soon as we realized that there was additional people who were associated with that conference coming down with the disease, we advised everybody who had attended, to self-isolate, not just to monitor themselves for symptoms. And a number of people have come forward since then because of that. I will also say that I have provided advice to all of the regulatory colleges about the actions that their members should be taking in the community right now to reduce the risk of transmission of COVID-19 in our community settings. So that includes chiropractors, dentists, physicians, nurses, anybody who works in our community, massage therapists, who fall under the regulatory framework of the Regulated Health Professions Act. And that advice is to minimize any physical contact and to reduce your practice to emergency services only. And there's some more details about that we can provide. I will note that the dental college soon after the conference and the notification that we gave for people to self-isolate, the dental college had also provided advice to dentists that they should cease all but emergency dental services in the community given the pandemic. And I think in some people's mind, those two messages became confusing. So in order to ensure that that's very clear for people who are practicing in the community, I have drafted, I sent a letter out to all of the colleges about the expectations that we have about safe practice at this point in time. I talked a little bit about our strategy and our strategy around testing. So we have a very worked out public health strategy for why we do testing in a certain way, how we've changed our testing, and it really has been looking at what is happening around the world, understanding and being informed by how things are being done in other countries, and being nimble in our response. So to be clear, we are absolutely testing and contact tracing anybody for whom we don't know the source of their infection. And that's the important thing. We talk a lot, I talked many times about the fact that we know the source of infection for people who are coming in from outside of Canada. And since we had the travel advisory in place, and since we put the order that everybody who's come in from outside of Canada must self-isolate for 14 days, if they do become sick, we know the source of their infection, and we don't need to have them go out of their house to go someplace to be tested, maybe exposing other people. We assume that they have this disease, and we manage them accordingly, and we make sure that they don't have contacts and pass it on to others. So that's how we break those chains of transmission. And that allows us to focus on the community cases where we do not know the source of infection. So as you'll know, we've done almost 30,000 tests. We've got our backlog where we had a lot of testing being done without a strategy. We've got that all through, and that's reflected in the numbers that you've seen yesterday and today. But now this allows us to continue to widely test anybody for whom we don't have an idea where they came in contact with this. So that's community cases that are involved with a cluster or an outbreak, or community cases that have arisen is part of our surveillance. It also means that we can aggressively test healthcare workers in our health system, as well as the long-term care residents and healthcare workers, so that we can manage outbreaks and protect our healthcare system. So that is the change in the strategy that we've had around testing. It's based on what they're doing in other countries. And when we talk about test, the focus is on making sure that we can identify where cases are coming up where we don't have a known source. And that's what we're focusing on right now. And finally, this is a reflection of the fact that we are seeing escalating numbers across British Columbia. We know that there is circulation and there is risk across the province right now. The majority of our cases are in the Lower Mainland, but no community in this province is immune. And we know this virus can spread with people having very minimal symptoms. And that is our rationale for making sure that we all take these physical distancing measures that we've been talking about in the last little while. The way we break the chains of transmission are making sure that we're not close enough that this virus can spread between people. So we're doing everything we can right now, and we need you to do the same as well. So we will get through this. None of us needs to get this virus. And that's where these physical distancing is so important. And extra important is not only do we not need to get it, we don't need to bring it home and give it to our parents or our grandparents or other people in our family, in our community who may have serious illness from this virus. So physical distance is incredibly important right now for all of us. And I know most people are doing their very best at this, and we can see that in our community right now. But the other part of it is ensuring that we maintain our social connections. And that is what's going to get us through this. So I encourage everybody to take those virtual connections with your family, with older people in your community. Don't have that physical contact, but maintain those social connections. That will protect our elders, our seniors. That will protect our healthcare system, and that will get us through the next few weeks.
Thank you, Dr. Henry. And as Dr. Henry has noted, today's report shows an escalating number of confirmed cases in British Columbia and an escalating number of cases of people currently in hospital, currently in ICU, and the seriousness with which the struggle that British Columbia is facing. That's 617 cases, of course, and Dr. Henry has laid it out by health authority, but what it shows is that no part of our province is immune, and that everyone has to take the steps that Dr. Henry has recommended to prepare and to avoid for the spread of COVID-19. I wanted to bring you up to date on progress with respect to occupancy in BC hospitals and acute care hospitals in BC. We have added more now available beds that are available due to our efforts to both move people out of hospital who do not need to be there. And so there are now 3,866 available beds. That our current occupancy is about 66%, or 2 and 3 beds currently filled, and that compares to what is ordinarily the case, which is about 103.5%. And currently, in terms of our critical care occupancy, that rate is 55.3% across BC hospitals at the present time, which is roughly what it was yesterday, and of course less than it was last week and at any time before that. I think that reflects, as I noted yesterday, and Dr. Henry has noted, the seriousness of the situation, the preparations being made in our acute care hospitals. And we continue to do that work every day in order to both prepare our acute care hospitals in terms of resources, and also to prepare our staff in terms of the challenging days to come. Dr. Henry has reflected, I think, on the extraordinary work of the BC CDC, and I just wanted to reflect on this a bit myself, that 3,500 tests is what we're doing every day, which is an extraordinary increase. It reflects the work and the leadership of the BC CDC, which has been unbelievably valuable to all British Columbians in dealing with these issues. It's really courageous and heroic work by people who have given everything they have to give us the means to deal with COVID-19. And with them, partners who are processing tests around the province, such as Life Labs, and then partners through the health authorities who have been assisting with that as well. This allows us to expand our testing capacity and to do and to follow the direction, the science-based direction of Dr. Henry. I wanted to also acknowledge the extraordinary work that's taking place in long-term care, led by those that represent management long-term care, and also unions in long-term care, in particular the Hospital Employees Union and others, who've done just remarkable things and are doing remarkable things to, in effect, reorganize the way significant parts of long-term care have been organized for some time in order to protect patients. It's extraordinary work. They've been all in on it, and we very much appreciate their work and the work of the BCNU and the HSA, doctors of BC and resident doctors of BC, and other health professions such as pharmacists and midwives who are every day stepping up to provide care and service, and we are so appreciative and so respectful. We launched an app yesterday that has had so far about 20,000 downloads, which is a significant success. We're seeing about 1,000 downloads each hour today, and I encourage people to check out that app. We received some questions through social media and other areas about advertising, so I wanted to say a few things about that the priority is to ensure that people have information they need during the COVID-19 pandemic. It's why we do daily briefings and many media interviews and share our messages extensively in multiple languages around BC. As you know, buying advertising requires booking weeks or months in advance. And since the declaration of the pandemic, our Crown corporations and government have been reviewing the ads they have in market and are pulling many of them. ICBC, for example, has proactively pulled its campaign on the changes to make ICBC more affordable. And our focus is on health information. Our focus is on COVID-19, and you will see that in the days to come reflected in new advertising. So I just wanted to make that point. Finally, I just wanted to say that we spoke yesterday about how this is going to be a struggle for weeks and for months ahead of us, that it's not going to end anytime soon. There's not a quick fix, although the measures we're taking now, the measures we are all taking now, will play a significant role in the outcome and why we have to continue 100% of our effort. There is no chance we'll beat this if we leave the work to others, that each of us doesn't play our role. We need everyone to. We must take care, all of us. The number of cases we've been seeing will continue to rise. It will. The next few weeks will be very, very difficult. It will be some time before we see the change we are all working towards. But what happens today matters in that change. What matters today matters in April and in the months that follow that. And we must make the effort now so that those efforts will pay off. Defeating this virus demands that we stay physically apart from each other. The battle that we need to wage to defeat the virus demands that we come closer together as a community. And I see that happening every day in the community I live in and across BC. It's essential we continue to work together, that we trust one another, that we rely on one another. It's why we brief and we provide information every day to British Columbians about what's going on, so they understand and people understand what's going on. We must be united because we all have a duty to deliver. What we need to deliver is what Dr. Henry has put forward to you today and in previous days. 100% compliance, 100% of us, 100% of the time. And in our fight against COVID-19 today and all days ahead, we must continue to be 100% all in. Aujourd'hui, nous vous donnons des mises à jour des cas sur 2 périodes de 24 heures, le 22 au 23 mars et le 23 mars à 14 heures aujourd'hui. Au cours de la première période de déclaration jusqu'au 23 mars, nous avons eu 67 nouveaux cas, pour un total de 535 cas en Colombie-Britannique. Au cours des dernières 24 heures, nous avons 78 nouveaux cas pour un total de 617 cas en Colombie-Britannique. Ça fait, dans les 2 jours, depuis notre dernière présentation, 145 nouveaux cas. Parmi les nouveaux cas, un patient est un travailleur de la santé au foyer de soins en résidence Little Mountain Place dans le régie de santé de Vancouver Coastal. Chaque régie de santé maintenant compte des patients atteints de COVID-19. C'est 330 à Vancouver Coastal, 194 à Fraser, 44 sur l'île de Vancouver, 41 à l'intérieur et 8 au nord. Au total, il y a eu 13 décès dus à COVID-19 en Colombie-Britannique. De plus, sur le total des cas de COVID-19, 59 personnes sont actuellement hospitalisées, dont 23 sont en soins intensifs et les autres personnes qui ont été testées positives pour COVID-19 se rétablissent à la maison pour l'isolement. Nous sommes très heureux d'annoncer que 28% des cas, soit 173 personnes, sont désormais rétablies et ne sont plus isolées. Merci beaucoup. Thank you, and we'll take your questions now.
Okay, so just a reminder to everybody that it is 1 question, please, and reminder to unmute your phones. You will not be audible until you are dispatched through. So we will start with Justine Hunter, Globe Mail. Go ahead.
Oh, hi, thank you. I wonder if you could tell me how many healthcare workers in total have tested positive for the virus, and what are the contingency plans to address any short staffing that may result from that?
I don't actually have it broken down by healthcare worker at the moment, but I can find that information for you. There is a large number, if we look at even the long-term care facility outbreaks that we're talking about, there's in the vicinity of 55 healthcare workers involved with those outbreaks, but I can find that information. And in terms of contingency staffing, absolutely, there's a very detailed planning being going on, looking at not only how can we supplement staffing at the long-term care facilities that are under an outbreak, but also how do we ensure that we have staff who are able to care for people who have COVID-19 in the hospitals, and there's backup plans for how we can do that. You may have heard in the last few days we've asked recently retired physicians to volunteer. We will be looking at things like triaging, so there is many different sources of work that a physician can do other than actual one-to-one patient contact. So we may not have older physicians, for example, provide patient care, but they may be able to provide virtual care and help with managing people who are in isolation at home, for example. And then we also have called up all of the residents and medical students who are no longer in clinical rotations. We've also got nurses who have either recently retired or are working in areas that are now closing down in the hospitals to help support things. And there's a strategy that the health authorities are working on for ensuring that the right people are providing the right services in the most safe way. So it is complex, as you can imagine, but that work has been started when we started our outbreak response, and it goes on today.
Just to add, Justine, I think we're going to have information about the re-registration of doctors and nurses in the next day or so you get a sense of that part of the equation, which is an important one. It's one of the reasons why we've taken the actions we've taken in acute care that we've described before, and especially the very strong actions that are being taken in long-term care to ensure that both our residents and healthcare workers are safe. But it also speaks to our obligation, I think, to the people working in healthcare to follow in the community, because healthcare workers frequently get COVID-19 in the community. And so we need to take those steps so that they are protected to the maximum possible. And that means, as I say, that people follow the recommendations and the orders of Dr. Henry at 100%, because it's critical that healthcare workers are protected. They're a huge part of our system in terms of the response, but also the people that healthcare workers work with are by definition extraordinarily vulnerable. So part of the reason why we have this obligation in the community to ensure healthcare workers are protected is that. And I want to say finally what I said, I think in the discussion, is the extraordinary role played by those who represent healthcare workers in all associations and in unions and in the community. Everybody has stepped up to the plate to deliver everything they can on behalf of patients and residents in BC. And that has involved very significant changes that are suggested in long-term care and the orders of medical health officers, but also the necessary changes to ensure that people are protected. And I would say in the case of all of those unions, everyone has stepped up in the public interest, and we're very proud of what they've done and very honored by their involvement in all of this.
Right, next question is from Binder Sudjan. Go ahead.
Hi there. Just wanted to ask about Douglas College. The college had put a note out today saying that there was a student that was in a campus library March 13th. It's been just over a week. Wondering how concerned people should be and what precautions they should be taking, and if you can confirm that case as well.
Yeah, so I don't know the details of that. If it was put out by public health, then there would have been a warning and advice about what people should do, whether that is just self-monitoring or whether they needed to do anything additional to that. So I'm not aware of the details of what Douglas College has put out.
Okay, Lisa Eusda, News 1130.
Hi there. I know that you've touched on this, but there's been so many questions about this doctor from North Vancouver, the dentist from North Vancouver who passed away. With what you're saying, is it possible still that this is connected to COVID-19? And people are wondering why more details weren't given out with so much rumor and comment going on about this.
Well, it certainly is possible it's related, and I will leave it to the coroner's office to investigate that. But we don't respond to rumors, and we won't be giving out information on individuals and their individual circumstances, particularly any of the individuals who died, and out of respect for their families. So if their family feels that they want to put out a response, and we've seen that with some people, then I think that's very appropriate, but it's not appropriate for you to hear it from me.
All right, Tanya Fletcher, CBC.
Hi, Dr. Bonnie Henry. Just clarifying, and I couldn't hear Lisa's question there, so pardon me if it's a repeat, but just going back to the dental conference, given the coroner is investigating, can you definitively say the dentist died from COVID? And if so, does that mean it doesn't include in the death toll? And then following that clarification, what about patients whose dentist attended the conference? What advice do you have for people who saw their dentist following the conference? There's a gap, I think, between the 7th and the 12th in that window. What's your advice to them?
Yeah, so there's a couple of things. We know of 32 people who became ill after attending that conference here in BC, and all of those were investigated by public health. There are a number of people, so if this person, I don't know the cause of death of this individual. I do know that they attended the conference and that they were known to public health and an investigation had been done. So it'll be up to the coroner to determine the cause of death. For anybody who saw a dental professional who had attended the conference, all of the people that we know of who were ill and saw patients while they had symptoms have been notified. So if you have not been notified, for example, we hear that people went to see a dentist on the 12th or the 11th before we put out the notification about, before we recognized that there was an outbreak related to this conference. If you have not been notified by public health, then there's no need to be concerned. The people that we know who had symptoms have all been addressed so far, and we're now past the incubation period for that conference. So people can be reassured that if you saw your dentist and they were fine and there was nothing wrong with them, they had no symptoms at that time, that you're not at risk.
Okay, next question is Mary Griffin, CHEK News.
Oh, hi, Dr. Henry. Thanks so much. I was just wondering, what can you tell us with the death rate? I know that the cases that come out are sometimes skewed because there's a backlog, but what can you read into, if anything, the rate of deaths in the province?
Yeah, so I think if we look at some people have said, 13 deaths in 600 people affected is very high. But we look at 10 of those deaths are all associated to one outbreak. So we consider that essentially one event. So it's not representative of multiple events in the community that have led to death. So if we look at some of the modeling from other countries, deaths can be indicative of hidden cases in the community. So what I'm saying is we don't have evidence of that. And I know there's been some people who have been concerned that the case fatality rate, we call it, is very high in BC. But I think we need to put that in the context of so many of them being related, unfortunately, to the Lynn Valley Care Centre. The pieces that are hard and fast are, we know how many people are hospitalized with this. We know how many people are in ICU. So those are numbers that give us a reflection of the community cases. I also will say that, we early on recognized that most of our cases had very mild illness. So at first, the recommendations around the world were that everybody who has this should be put in hospital. And and having been through SARS in Toronto, that was the way we did it, because we knew that people developed severe disease sometimes very quickly, and that we were best able to isolate them and monitor them in hospital. And for the most part, people didn't have very mild disease. With this, as we were watching, we were seeing that many people had very mild disease. So we made the decision clinically here in BC to manage people at home as best we could, because we knew that would protect our health system from inadvertent exposures players in the health system. So I think that is also reflected in some of our numbers that may be different from other countries where they put everybody in hospital. So they may have very mild cases in hospital. So it's challenging to to compare across different countries and how we're managing our cases. I think we made the right decision in how we're doing that, because many of our cases had very, very mild illness and were managed effectively at home, and that meant that we didn't need to expose people in our healthcare system. So having said that, we have been looking at comparing our outbreak with what's happening around the country and around the world. And later this week, we'll be presenting some of how we're using that to understand how we need to be prepared, but also to understand how our curve is progressing over time with some of the modeling that we're doing. So we'll be doing that later this week, either Thursday or Friday.
Okay, next we have Richard Zussman from Global News. Go ahead.
Dr. Henry, just wondering what the advice is for British Columbians who are contemplating attempting to conceive a child, if there's any advice and concerns that should be raised there. And around, I know you've spoken about pregnancies before, but is there any additional advice in terms of whether people should consider or look at potentially home births?
Yeah, very good question. I think you tried to ask that yesterday, and it wasn't clear what you were asking about. There's no evidence that I've seen yet that this virus can be transmitted through sexual contact, for example. We know that it is shed in the stool in some people, but as well, there's not a lot of evidence, or at least there's nothing that I've seen yet that shows that that's a mode of transmission between people. So in terms of conception, I don't see that there's any issues right now. It may be challenging if you're sick, but that part, there's no evidence that we know of. In terms of people, we are following very carefully pregnant women around the world, and here in BC and in Canada, there's a great group with Women's Hospital that is monitoring very carefully and looking at the clinical assessments that have been done around the world. It doesn't seem that pregnant women are more susceptible to being infected. It doesn't seem that it's transmitted to the fetus at this point. So that's some of the data that we've been following. Obviously, there's very small numbers. And Women's Hospital and the obstetricians around the province have been very working together to make sure that everybody who will be delivering in the next few months is able to do so safely in the best place that they can. And for many women, that will be in a hospital in the province.
Next question comes from Fran Yanor from The Goat.
Thank you. Hi, Dr. Henry and Minister Dex. This is about your efforts building capacity. So you have 59 people in the hospital, more than 4,000 empty acute and critical care beds that are empty. The implications of that are a bit staggering, but you say it's not enough. And yesterday, Minister in the House, you mentioned modeling. So I'm just wondering if either of you can speak to your end goal here and the science that is driving this aspect of your process.
Yeah, so our end goal is to keep things we know that we can't prevent transmission of this virus from everybody who's out there right now who has it. So there's been exposures in the past 14 days where people are starting to get sick. What we're trying to do, of course, in the community is stop those transmissions and decrease them. But there are people out there right now who are incubating. So we know there's going to be more cases identified over the next week to 14 days. What we want them to come in a trickle, not a flood. And that's what we're working on very carefully. And we know that it's different geographically in different parts of the province and parts of the country. So some parts of the province, it's still introductions from other places, and we're able to manage them. In the Lower Mainland, in Vancouver Island, there's community transmission that is driving what we're seeing right now. So that's one of the really important reasons why we have these community measures in place. So what we want to do is make sure that as people people are going into hospital, into ICU, that we're able to manage the load so that as people recover and get out of hospital, those beds become available for others. We have seen, and we'll talk about it later this week, in other countries that sometimes that it can rapidly increase the number of people who are infected. So that's what we're holding our breath on right now. Every day we're getting more cases. Every day we have more people who are going into hospital. But the measures that we're doing on a community basis and continuing the testing and the management of clusters and outbreaks and individual cases in the community is what we're trying to do to break all of the chains of transmission, to keep the people who are getting sick with this at a trickle that we can handle in our system. If that doesn't work, we need to plan for the worst, which is making sure that we have lots of capacity. We have both the beds, the ventilators, and importantly, the people who are able to manage people through that over the next coming weeks to months.
Yeah. Just to say that it's not over 4,000, it's 3,866 available beds. That's based on, those are March 24th numbers, so they're today. And what that indicates is preparation. And I think it was a necessary preparation, but it was a very, very difficult decision that Dr. Henry, that the work that we've done and the modeling we've done prepared us for, which is to prepare the capacity we need and the supports and the training we need for healthcare workers, from doctors to care aides who might well be doing different things during this outbreak. So this is preparation. And you're going to see some later in the week, as Dr. Henry has said, some of the modeling that this is based on. But essentially what we're doing now is ensuring that to the maximum extent possible, we're not caught short. People they've asked this question repeatedly, which is, do we have enough? Well, that will depend, at least in part, on our collective efforts to be 100% behind the measures ordered and proposed by Dr. Henry. So we all have a role in that, but what's happened in our hospital system over the last 2 weeks is unprecedented. I don't think we've ever seen these levels of occupancy, which means or these low levels of occupancy, and it's because we're preparing and understanding that we have to be prepared for the possible influx of patients. Everything we do in the community, though, from all the work being done in virtual health, all the work being done by people taking samples, by all the work being done by testing, is to, as Dr. Henry suggests, limit the number of people at any given time come in and allow, of course, other people to recover. And we're heartened. And I'm certainly heartened to get the news that a very significant number, 28% of people diagnosed, have now recovered, which shows that there is not just a growth here, but there is a growth and a diminution that can happen if we continue to do our work. But for the next little while, I mean, you can see what we're doing, how we're acting, by preparing hospitals and by having many empty beds right now. It tells you that we are preparing for a much more difficult situation, and a more difficult situation, a much more difficult situation is pretty much inevitable.
Next question, Keith Baldry, go ahead.
Dr. Henry, you haven't made any more public orders for the last couple of days. Is that a reflection that you think that the physical distancing is working? Do you anticipate making more public orders in terms of limiting movement of people or the operation of commercial establishments?
Not around that. And yes, I do think, if we look at what other places have done, even in Canada, about locking down, what we've done is essentially that. And it's taken some time for people to get their heads around that and to understand why we're doing this. And we're seeing progress. We won't see progress in the numbers for a period of time. So we're still seeing increasing numbers of people being infected by this. But I am watching very carefully, because what we have done in the last week, 10 days, is going to make a huge difference in the next week, 10 days. So that's what we'll be watching. I did issue one more order. I'm not sure if it's actually completely finished yet, which is around healthcare workers not being assigned to a single facility for long-term care and assisted living, to make sure that we're doing everything we can to stop that intermingling that has led to the clusters that we keep seeing in our long-term care homes, and to protect our seniors and elders in those places.
Ian Bailey, Globe and Mail, go ahead.
Doctor, a question linked to this curling event in Alberta and the BC implications there. Any sense of how many BC doctors at this event, the doctors were from BC, and whether they are among those who've been declared ill or indeed deceased during the pandemic?
Yeah, I don't. I know there's quite a high proportion of the physicians who attended that Bonspiel were tested positive. I think I heard today it was something like 16 out of 47 or something, or 67. I don't have the numbers exact, but that was what my colleague from Alberta reported. I'm not aware that there were any BC physicians there, but I don't know the details of that. I can try and find out, but I believe it was. So I'm not aware that there's any BC physicians who were there who are ill.
Okay, next question comes from Shannon Waters, BC Today. Go ahead.
Hi, Dr. Henry. I'm curious about this capacity building that's going on in hospitals. And are you able to tell us the criteria for releasing people? I've heard some concerns about, people potentially being pushed out of hospitals when there's not a good care situation at home, et cetera, et cetera. And so could you tell us a little bit about the criteria they're using to free up these beds?
So you're talking about people who are non-COVID people. So, that is done on an individual basis across the system. And there's criteria that people use, what the illness is, how they're able to be supported at home. So I can't tell you about individuals, but I know that that is something that is managed through the operations people at each hospital, and it's done on an individual one-on-one patient basis.
Yeah.
I don't know if you want
to say that there are two approaches. The significant number of beds that have been reduced by the cancellation of elective surgeries as well. In this period, we are also creating space in the long-term care system. We talked about, I think it's called the Summit at Quadra, that space that will be opened up to help people who are currently what are called ALC or alternate level of care patients move to an equivalent care outside of the hospital, and I think those are the steps we're taking. And if you see the differences in some health authorities, it's because some health authorities have less surgical patients and more alternative level of care patients within some of the smaller hospitals. So you see slight variations in how we're doing, but really those are two sources to ensure that we reduce the number of alternate level of care patients, and those are the challenges that are challenges for both the care system, the long-term care system, assisted living system, and home support on the one hand, and then on the other, the impact of the cancellation of surgeries, which is the largest number, as you would expect, where we've canceled thousands and thousands of surgeries, and that has an impact on every hospital where there are surgeries, especially those hospitals where there's significant amount of elective surgery.
All right, and we have time for one more question, which comes from Jennifer Saltman at the Vancouver Sun. Go ahead, Jennifer.
Oh, hi, Dr. Henry. You did mention Italy and the situation there, but to clarify, do you agree with BC doctors who've said that the province is heading in the same direction as that country in terms of cases and deaths? And if not, what is BC's data and modeling telling the province at this point?
I'm sorry, it was Italy that you had said? You just cut out there for a minute. Yeah. We are all very concerned about Italy, obviously, and we're watching other countries as well. But I think there's been a lot of social media. There's a lot of clinicians from Italy, a lot of connections that we're hearing a lot of information from there. So I will be presenting the modeling in some detail, but I do not believe we're on the same trajectory as Italy. We've also put in measures at a point in time that is quite different from when they put in measures. And I really do believe that our, like the US as well, our testing strategy early on helped us better understand what was happening in our community and when we started to have community spread. And I think both in northern Italy and in our neighbors to the south, particularly Washington State, not having access to that testing early on meant that they were trying to play catch up and understanding where people were in the community. We now clearly have community spread in BC and have had for some time, and we still have a better understanding of where that spread is and how to manage it than if we had not done the amount of testing that we had done ahead of time. So I will show you some of the curves, and obviously we watch them very carefully, but they don't change on a day-to-day basis as much as I'd like them to. So we are monitoring it over time. We've got some really detailed modeling from some of my colleagues at the BC Centre for Disease Control that helps us understand how we're going on an ongoing basis. So stay tuned for the details on that.
Great, that's all we have time for today. Thank you, everyone.